My name is Shelby Kingsley, and I'm an ALS patient who has had to fight for my right to receive a life-preserving drug, and I'm not the only one. When we were first denied, we were told it was due to Blue Cross Blue Shield of Texas deeming Qalsody medically unnecessary. We ended up appealing the decision 3 times. By the last denial, we had caught the attention of the Senior Vice President of Policy and Advocacy with the ALS Association, who started to reach out to senators and other legislative bodies. Thankfully, the next decision we received was an approval, and I was able to start Qalsody. It honestly shocked me how difficult the process was to get approval for a life-preserving medicine for a disease that doesn't have many options. Almost every other ALS patient I have met has a similar story to mine. We are already fighting a horrible disease. We shouldn't have to fight insurance as well.
Thousands of patients across America, especially in 2025, face the same insurance and financial challenges as Shelby, the patient seen in the previous clip. Whether it be insurance coverage issues or just an extremely high price of treatment and medicine, there's a large number of citizens that struggle to pay their medical expenses in the United States. There are 3 main reasons that cause healthcare affordability to be an issue in America. The first is due to high insurance prices and premiums. The second is due to a lack of diversity in medical suppliers. And the third is the high cost of advancements in treatment options. According to Blue Cross Blue Shield, prices for medical care increased 40% faster than everyday prices, like groceries and gas. This, in turn, caused insurance premiums and copays to increase as well. While there are not many solutions available to the everyday citizen to combat inflation, there are many things that insurance companies could do to combat this issue. For example, in a survey that I conducted involving 16 adults that have had first-hand experience dealing with medical insurance and providers, 87.5% of them believe insurance companies have too much jurisdiction over medical decision-making. A solution or compromise to higher insurance costs would be for insurance companies to expand coverages, allowing patients to have more access to previously denied treatments, as well as less of a financial burden to carry the weight of. In an interview I conducted with Tammy Lamars, a certified financial planner and counselor at Akron Children's Hospital, Lamar states the following when asked if there was a specific group of people that have the most issues with the financial side of healthcare.
Generally speaking, yes. I feel families with children who have chronic or complex medical conditions often struggle the most with the financial side of healthcare. Here at Akron Children's Hospital, we see this particularly with patients and families that deal with conditions like cystic fibrosis, diabetes, heart defects, and even cancer.
The monopolization of hospitals and lack of diversity in medical suppliers allow for large hospitals to charge unreasonable amounts of money to their patients. For those with chronic conditions, these expenses add up quickly. David Baran, a medical expert, writes in his article that currently 3 multinational companies control over 95% of the world's global insulin supply. A possible solution to combat the monopolization of hospitals and medical suppliers is to build more hospitals or even increase funding to smaller hospitals in those areas. While some may argue that insurance and governmental assistance programs are there to relieve those of the medical financial burden, these financial support organizations cannot outrun the rapidly increasing price of advancements in technology and treatments, as well as inflation. To conclude, the increase of insurance prices, the low number of medical suppliers and manufacturers, and the high cost of medicine development are all driving factors for the increased cost of healthcare in America. Despite governmental assistance programs and insurance, American citizens still struggle with the financial burden that comes with seeking medical care. Medical bills continue to increase in cost for both insurance companies and for patients in America. Those who need health care should be able to afford it comfortably while also maintaining a balanced lifestyle.